We are here today with Ali Ciger from Pfizer, who will present how big pharma like Pfizer is cooperating with other healthcare stakeholders to fight the crisis. Ali is the commercial director for pain in Pfizer in Germany. He is also an investor and an advisor for an AI company based in Berlin. Ali, thank you for being here with us today.
Ladislav, thanks a lot for the invite. Glad to be part of the conversation.
So we invited you to give us your perspective as a Pfizer commercial director on understanding the strategies for big pharma fighting the COVID-19 pandemic. So how do you see the role of biopharma in tackling the current pandemics, seeking the way out of the crisis and beyond?
Yeah, thanks a lot. So I think to comment on the role of biopharma, we should first take a step back and look at the major impacts or the major changes that the whole situation poses on the society in which we live in which pharma actually exists, the ecosystem. The first impact is, I think, an awakening regarding the science to develop a vaccine and a treatment and all of the evidence requirements around it. And the second one is, again, I think it's an awakening regarding the value of health and being healthy, right? I think those two aspects bring in a lot of spotlight into biopharma companies. And I mean it in a very positive way. It's so huge that I could say I never experienced such a thing in all of my career. And because like previously when pharma was under spotlight, it was more on the cost of an intervention rather than the value of an intervention, right? So under this ecosystem, I think what pharma is doing in terms of strategies during the crisis, I think there are two of them. One of them is obviously to deliver the treatments and vaccines to the patients who are in need all around the world. It is, I should say, easier said than done, considering the supply chain being quite complex and interdependent, as well as the demand could be quite volatile these days. And the second one, obviously, to be part of or to find a solution to this problem, to the virus. It could be either through a vaccine, it could be either finding a new molecule, or it could be through repurposing an existing treatment to this new indication, right? And I think those are kind of the only options as a society we have to, move forward to the next normal. Obviously, there is the third aspect, which is to keep the employers safe, but it is not pharma specific. So I think like it's not worth mentioning or going deep into that. So that's during the crisis. Well, after the crisis, I think it will be a different game for sure. And I don't want to be prescriptive because I don't think we know for sure what would happen. So I think we should approach it with more questions rather than answers. And I particularly have two questions in my mind. One of them is related to the experience of patients. How would it change? Like the whole patient journey, how would that change? To be specific, for example, would the patients like the prescriptions to be delivered to their home, the adaptation of telemedicine, other digital health solutions, etc. These are fundamental shifts. I think biopharma can and should play an active role in shaping this new patient journey for the better. And the second one would be around the physician interactions, basically. As physicians are now redefining kind of their role or their interactions with the patients, they would probably do the same with other stakeholders, including biopharma companies. And I think we should find new and meaningful ways to interact and to collaborate with physicians that are out there helping the patients.
Thank you. So definitely there's a vision and on the current and on the future to come. When we look at the current situation, what corporations in biopharma do you see that are in place already that are bringing tangible results or are on the brink of bringing new products to the market?
Yeah, well, I think that's a very important aspect of the situation right now. first of all, I mean, we all know it, but I think it's important to emphasize bringing a new product to the market is a very complex process. You have to have access to cutting edge science and scientists. You have to have the scope to generate the relevant evidence. You have to have the experience and diligence to comply with all of the regulatory requirements and market access conditions. And you have to have the scope to produce the solution at scale. All of these steps are resource intensive, and pharma model is just built to make this possible. However, what is different right now is, I think, there's the time pressure, right? So each and every day, unfortunately, there are thousands of patients losing lives to this condition. And in such a case, you cannot waste the time. Like every day you spend, you have to think twice if you are working in biopharma these days. So I think that is kind of a big motivation for collaboration. And there are, I think, remarkable examples across the industry, and I will just name a couple of them. First, for example, there is a consortium of big pharma companies, I think around 15 of them, together with NGOs like Bill and Melinda Gates Foundation, and they're opening up their proprietary knowledge of some compounds in terms of safety and efficacy that could be helpful for the others as well. I haven't experienced such a thing before. Another example is, for example, GSK and Sanofi collaborating, like two big players collaborating for a new vaccine. One of them has expertise in recombinant DNA, the other one more expertise in adjuvants, so potentially a good match, right? Pfizer has a collaboration with a German biotechnology company, BioNTech. But beyond that, for example, for Pfizer, I can say that there was the moment they announced that they could potentially shift the production line and spare the current excess manufacturing capacity of Pfizer, if there would be other companies to, find the solution first. I think that was very remarkable, right? And it is, again, it is quite unusual as well. And I think maybe as a last point from biopharma, like again, big players like Pfizer and Merck and Lilly, they announced that the medical expertise in the company, the physicians working for these companies, are free to volunteer their services to the communities that they live in. I think it's again a good example of collaboration with other companies and with the society in which we live in. But I don't think it is only biopharma. There are also examples with, let's say, non-traditional healthcare stakeholders. Like just a couple of days ago, it was announced that I think 26 CROs, contracted resource organization, and data analytics companies, like big players like SAS, Elsevier, etc., they are collaborating to build a secure patient-level database to be open to public health research anonymously, obviously. And obviously, there's another example of Apple and Google collaborating together for Bluetooth-based solution to keep track of infections. Like, these are all remarkable, and I think the level of collaboration is just second to none. And I think that spirit makes me just hopeful these days.
Yes, you can see that there's many changes happening in the past couple of weeks we haven't thought that would happen in years.
Yeah.
So we see a lot of new development, as I said, in the field of new vaccine generation, a lot of R&D projects, clinical trials opening up. The question is also, what will remain after the crisis when we see some major developments in COVID-19 subsiding? So what is your opinion on that?
Yeah, I think that's the million-dollar question, right? I mean, what happens with the pandemic would stay with the pandemic, or will it stick? And I think the honest answer is we don't know. My perspective is, like, there are two extremes, right? One extreme is what we are witnessing right now, and probably one extreme was what we were witnessing a year before. My perspective, the truth would lie somewhere in between. Just to give how diverse these two extremes are, I will just name a couple of examples once more. Let's talk about vaccines, for example. Like previously, the industry benchmark to develop a vaccine was around, like, on average, 8 to 10 years. And now we are talking about 12 to 18 months, which is optimistic, but still probably possible. Then hopefully what happens if a company develops a vaccine in 18 months? Is that the new industry benchmark, or will we just discard it as an outlier? Once more, like, we don't know, but probably somewhere in between, right? And then there is the aspect of, let's say, policymakers and the governments intervening in healthcare. Major governments around the world are developing healthcare apps to track the infections. So after the pandemic is over, will these apps be discarded? Or will the next step is to develop it even further? Like, why not, if you have an app, why not track the other infections? Why not track vaccinations, etc.? And, you know, these are very different options that we were not thinking, as you said, a couple of months before. Or consider patients. Like, it was always thought that healthcare consumerism to be more of a US thing, and the European continent could be like lagging behind, etc. Or the use of wearables, other sensors, mobile health technologies is sometimes perceived as a niche. However, now it's an integral part of the whole system, right? What would all these experiences of patients and physicians through telemedicine, using the apps, etc., how will it change the interaction, right? Will it be, the next normal would be a patient having an initial diagnosis, visiting the physician, and then, you know, how will that change the whole game? So, like, once more, I think we don't know the answer. So this is a complex system, this is a non-linear system, and this is a non-reversible system. So it is, I think, for sure that the next normal would be different, but how different would depend on, I think, how policymakers would respond, how public, the patients would respond, and how market players like biopharma, physicians, associations would respond. I think that would be the next normal. So we will see how much of this agility would stick and how much of it is just for the pandemic.
Yes, there's a lot to expect and a lot to look forward to in the development of the things. So Ali, thanks a lot for being with us here today, and look forward to seeing you in our future events.
Thanks for the invitation. Thank you.
So today we're talking to Beny Rubinstein, former Microsoft executive and advisor and board member of several startups, about what Israel has been doing well and why in managing the COVID-19 pandemics. In today's connected world, other countries can learn from each other's best practices, and it is worth noting and learning some of the practices from Israel, the startup nation. It is not just about how Israel is combating the coronavirus spread using technology, but also about the Israeli attitude in facing adversity and coming out stronger. So Beny, thank you very much for being with us here today.
You're welcome, Thomas. Good afternoon. Thanks for the invitation.
So the recent Forbes report states there is an impressive count of approximately 150 Israeli startups working to combat the coronavirus outbreak. So can you please give us a brief overview of the initiatives in Israel, which are bringing in the latest technology to fight the COVID-19 pandemics?
Yes, definitely, Thomas. There is quite a lot of action here, as you can imagine. I mean, the ecosystem for startups and venture capital, even though Israel is a relatively small country, is very active. As soon as the COVID crisis hit in the first quarter of March, we've seen a tremendous mobilization of all these players coming together, both in the public and private sector. So to give you a few examples, last week we had a series of conferences with multiple VCs, and a couple of things were shown. One of them is the pace of investments in some sectors, of course, had slowed down a bit. That said, particularly on the most affected sectors, such as health, there is actually a pretty steady number of investments. To give you a couple of examples, one of the largest funds here in Israel is running over $1 billion in capital. Is called Amun. Amun Fund is now on their third fund. Luckily, at this time, they are in the early stages of deployment of their capital for the third fund, which is a $660 million fund. That fund has invested in a large variety of companies, going anywhere from the diagnosis of the virus to research for the vaccine. It's just incredible to see how much activity is there, not only to continue to nurture those ventures, but also to collaborate with government entities, both in Israel and abroad, in order to make an impact right now.
Great. So that's really, you know, a good background basically, and you know, we have seen this robust approach also on the cultural front, because Israeli nation has been able to thrive despite wars, terrorist attacks, and daily stresses of life. And over the years, Israel has learned to be resilient and develop agile approach, tackle complex problems. So then if you can tell us more about this agility and where we can see it.
Yeah, definitely, Thomas. I'm going to share my screen just to give you a visual of some of the things that are happening here. Just 1 second. So, are you able to see my screen?
Yes.
Yeah. So, just for the sake of this conversation, it's a very long topic, but just I wanted to focus on 3 basic ideas here. Again, those ideas are not novelty. I think in retrospect, everything we're seeing here, it's an incredible pace. It's quite amazing to see, but none of that is new. It's just the fact of things that were already there, and the sense of urgency made us, improve the pace of development. So the first one, it's relatively unique about the Israeli culture in general, and we see as one of the drivers for relatively good execution this time. I used to be a judo fighter when I was younger back in Brazil, and we used to say that the adversity is your best friend. If you have a very strong opponent, you shouldn't be intimidated. You should actually leverage it in your own benefit. So the way Israel has taken this, Israel is a nation that was created in 1948, has gone through major wars and lots of different challenges. One of the things that was done here was to treat this as a war. So, in the public speakings the Prime Minister and his ministers gave, they actually alluded to the virus as an invisible enemy, and we need to fight an enemy that we can't see. So that's one of the principles I wanted to illustrate here, and I wanted to actually show a couple of things that are very peculiar also to Israel. There is, as I mentioned, a very strong presence of academia and lots of research on biotechnology and several PhDs and authorities. But on the other hand, we have a very strong army. We have a very strong intelligence units with great knowledge and great experience and great technology. So I wanted to show a little bit on how we were able to adopt kind of an entrepreneurial view, kind of very adopted from the startup world, where you're not defined by the situation, you're defined by how you react to it and how you become something else. And in this case, clearly this is a very pluralistic and diverse society. But at this point in time, we all united towards this battle. So, if you look at my bio, I've done a lot of different things in the health space in Microsoft. But the one thing that I tell people is you're going to be able to fail and fail fast and learn fast. And this is exactly what we're doing. I mean, we didn't try and say we have all the answers. No one does. We try to say is we're going to put a plan and we're going to iterate very, very quickly. And as you know, many organizations, not just multinational companies, but governments specifically, have a trend to be a little bit more risk averse and a little more cautious. In this case, we are kind of adopting this pace of change. And if you really look at even the job landscape, the skills that we have today are not going to be useful for the future. So if you take a look at what's happening here now, I just picked a couple examples this morning from the website. These are all news from the past couple of weeks. The IDF, which is the Israeli Defense Forces, have, for example, a facility where they would actually do maintenance of the tanks. They have a lot of tanks, old tanks. They need to restore them, whatever. In a matter of, I'm not talking about months, in a matter of days, they were able to repurpose. As soon as it was detected that there was a very high risk that the medical staff was going to get contaminated as well, there were not enough gloves and goggles here. they decided to repurpose a factory that was designed for maintenance of army materials into a facility that actually produces 1,400 pairs of protective goggles a day. So the medical staff has that. You don't have to actually rush in to buy from international markets and so on.
Great, and this leads me into my next question, because we have seen several Israeli solutions already in place. Just mentioning the AI-based triage platform by Diagnostics Robotics, which also is used by Israeli Ministry of Health in the nationwide scheme on monitoring the coronavirus symptoms. And these are examples of how public officials, public decision makers are collaborating well with the innovative private sector. So what other countries can learn, because we have seen that there are many other countries outside Israel interested in these solutions, what they can learn from this collaboration between the government decision makers and innovative companies?
Yeah, it's a great question, Ladislav, and I want to get you into philosophy or political views, but I think that's, you know, to give you an example, diagnostic robotics has been used here already in Israel. You know, it was built by a former scientist from Microsoft Research, which I had the pleasure to meet many years ago. She actually offered the technology to the Ministry of Health in order to contain specific problems we had in cities like Debrak, where we had a bigger surge of the epidemics. So my point is, you know, she's reached out to the community here and says, if you have contacts abroad, the Ministry of Health abroad, we're more than happy to collaborate. We're not looking for profit. We are a for-profit company, but we just need to cover our costs. We really want to get this technology in the hands of people. So I think it's a great opportunity, you know, especially in this global forum of future of health, that we really learn how to be more agile. You know, feel free to contact me if there is interest in technology such as diagnostic robotics. We already connecting them with the Ministry of Health in Brazil, and we'd love to help as many people as possible, and also to learn from other practices. I mean, we're still searching for many answers, and we're very happy to be transparent and share whatever we can.
Hey, thank you very much for your time and for your insight today, and hope to see you in the Future of Health Summit in the future.
Thank you very much, Ladislav, and stay healthy.
Stay healthy, stay. So today we have with us Shafique Ur-Rehman, who is the CEO of a private hospital from Pakistan. Shafique is advocate of healthcare, digitalization, and challenges he has been facing are similar to many healthcare executives around the globe. So despite challenges, Shafique has a strong vision that he's putting in place at his hospital. So Shafique, thank you for being with us today to share your vision on future healthcare.
Thank you very much for having me. I think we're living in very challenging but interesting times. My future vision for healthcare is a healthcare landscape which involves even greater collaboration than what exists between the different stakeholders. Talking about Pakistan, like many other developing countries, we have a very fragmented healthcare system, which consists of private providers, public sector hospitals, as well as a lot of non-governmental organizations as well, which are doing a great job, but on their own with very limited collaboration between themselves, which results in suboptimal utilization of their capacity, and there's inadequate sharing of data, which I feel directly impacts the quality of care that we are able to provide as a health system overall. Going forward, I feel here is an opportunity for us to realize and appreciate the need for greater collaboration between all these healthcare providers. I'd just like to cite one example which will elaborate this point further. When the COVID-19 situation struck Pakistan, actually, we were one of the largest diagnostic setups in north of Pakistan providing PCR testing. We had ample capacity, but there was very little coordination between the different stakeholders, which meant that there was inadequate testing that was happening for a fairly long time. And we had that window of opportunity whereby a lot more testing could have been done, provided there was better coordination between all the providers. And even when the testing did commence, we had to rely on some very rudimentary means of sharing data, such as WhatsApp messages or emails. Whereas if there were a suitable platform that existed, it would not only ensure that this capacity that existed, the very limited capacity that existed, could have been optimally utilized, but more importantly, this data could have been securely transmitted to the different agencies that were working on tackling this crisis in its early stages.
Great, thank you. And so we are here actually, and you were leading into it. So we are here to talk about how COVID-19 is impacting or actually speeding up the digitization of the healthcare systems. And we already can see some initiatives being developed in Pakistan, such as Sehat Kahani or IHS mobile testing that they started with the Finnish company. So in your view, so how much will the COVID pandemic speed up the digitalization of healthcare systems? Absolutely.
I think within all this gloom that exists and all this crisis situation that exists, there also exists a great opportunity. And that opportunity is for health providers to adopt all the digital technologies that have existed for a very long time, at least have come up in the recent past, but to speed up their adoption in order to meet some very real world challenges that we are seeing today. So it is an opportunity for us to gear up our health systems for the next challenge, because I'm firmly of the belief that it's not a question of if, it's a question of when the next such major health challenge will be confronting the world. So citing the example of Ur-Rehman Medical Institute, the institution that I represent, as soon as the different hospitals started cancelling all the elective procedures and routine outpatient consultations upon the directives of the government, there was an urgent demand, not just from clinicians, but patients as well, to provide some kind of an alternative to handle these conditions. Because we do need to realize that in pandemic times, such as COVID-19, all the other health conditions, they don't disappear. In fact, they're exacerbated in many cases, and they have to be handled as well. Otherwise, we risk facing a situation much more dire than COVID. So telemedicine is the kind of solution that people were looking for. We in our institution had been thinking about this for a fairly long time. But we fast-tracked that project, and the last couple of weeks, we managed to roll out a telemedicine solution, which is a mobile app, whereby patients can connect directly to the clinicians, and it's fully integrated with our EHR system, which means that the clinicians have complete knowledge of all prior encounters that the patients have had and are able to provide valuable consultations and urgent interventions. So there's been a clear realization of the digitalization of health systems and how they could have an impact on better management of this pandemic in terms of detections as well as treatment.
Great, thank you. And so having implemented your solution, so what are the key challenges? Because we have seen many regulatory challenges or technological challenges when companies and healthcare providers wanted to start up with digitalizing the healthcare, especially in these times. So what have you faced in your case?
I think we've been privileged in a way because health information technology is something we. So a lot of the IT systems we have are already cloud-based. So when we started home health services, whereby patients could have their lab samples taken from their residence, or for example, pharmacy deliveries to be made at home, we had all of those systems in place and they were existing on the cloud. So rolling it out outside the campus was not really a challenge. I'm firmly of the belief that technology is no longer a bottleneck, it's no longer a hindrance. Adoption and suitable utilization is what the challenge is. A lot of these difficulties are more cultural in nature. So, I mean, we all use, we're having this conference on a video call. So we use all these collaborative technologies in our everyday lives. And it's a valid question. Why haven't we really embraced these technologies over the years in order to meet some very real healthcare needs? Not all of the patients that are walking into hospitals really need to walk into hospitals. A fair proportion of those patients could benefit from a teleconsultation. I think we, again, I see this as exists on a massive scale, unprecedented in our times, and the technology and the solutions are out there. So we're very confident and we're very proud of the fact that we've implemented solutions in a couple of weeks, which we earlier thought would take us several months or even years, because the need exists, the appetite is there, and we've managed to roll it out. So generally, I think it's just the willingness to embrace technology to meet some real world challenges.
Yes, this is a great point because many companies and also it's global. The global trend that everything is taking much, much faster than it has so far, and we couldn't have imagined even. But there are also voices that are raising concern that once this subsides, we'll get back to the traditional pace. What is your opinion on that?
I really don't think so. I think many of these technologies are here to stay. So talking about telemedicine, when the government announced a lockdown whereby patients could not leave their residences, we were forced to act. We had to provide an alternative. Living at home could not leave their home unless the situation was really dire, who needed lab investigations, who needed all of these other services, and we had to respond to the same. On a similar note, for telemedicine as well, for example, if we routinely look at 800 or 900 patients, I would say at least 30 to 40% of those patients are for very minor issues or are follow-up consultations, which in many cases could be done via telemedicine. So once we've embraced the technology, and I speak for both sides, the provider side as well as the recipient being the patient, once they realize the value of the solution, that they no longer have to travel long distances for a brief encounter that could very well be conducted virtually, I think these things are here to stay. And we need to look at this as an opportunity to adopt these on a rapid scale and see how they can be used in the future as well. Just one other point that I'd like to add is the COVID situation has also helped us realize the importance of preventive healthcare. I think many providers focusing on the curative side of health. So we've managed that well. We're doing that for a long time. But even in the early stages of the coronavirus crisis, there was a realization by all providers as well as the government that no one really had the capacity. Even the developing countries didn't have the capacity to handle the situation if it reached the alarming proportions that we're seeing in some of the Western countries, unfortunately. Capacity in terms of testing capacity, in terms of the beds, in terms of ventilators. And that is why we see such a massive emphasis on the preventive side of healthcare through awareness campaigns and so on. That's another example, and that's been done much more effectively through digitization, through all the technological tools that are available to us. So I think many of these changes that we see during COVID times, whether it's working from home, whether it's telemedicine, whether it's this awareness and the preventive aspect, I'm fairly confident that these are here to stay and they are going to be scaled up and adopted by even more institutions going forward.
Shafique, thanks a lot for your innovative and visionary views. I think you have provided a very, very good account of what you have been doing and what can be done in the future. So we hope we'll stick to the digital trends that COVID has started. So in all bad, we can see something good happening, and this is also on the good side. So thank you for your time, and hope to see you sometime in the future in our Iceland seminars.
Thank you very much. Pleasure being here and talking to you. Thank you.
Thank you. In the past 2 decades, Estonia has become a pioneer of converting public services into online solutions for its citizens, and Estonia has become one of the most advanced digital societies in the world. So naturally, we're looking at digital health solutions to fight COVID-19. We look at Estonia for the best practices and inspiration. Just to mention, 99% of prescriptions are digital in Estonia, as well as 95% and more of data generated by hospitals and doctors have been digitized since 2015. So definitely a country to look at. And I'm here today with Priit Tohver, a medical doctor and advisor for digital service innovation at the Estonian Ministry of Social Affairs. And Priit is also an active member of the roster of experts on digital health with World Health Organization. Priit, welcome, and thank you for being here with us today.
Pleasure to be here.
So Priit, my first question will be on, if you can give us a brief overview of what digital tools have Estonians applied or have utilized in developing in tackling the COVID-19 pandemics?
Sure. So I think the most important digital tools were already present when we entered this crisis. So it has to be the interoperability of health data, because day in, day out in this crisis, you need information. You need to know how many infected persons there are. You need to know how many hospital beds you have, how many people are actually in hospital. So this is the kind of things that you make decisions on. And the fact that we have this national EHR in Estonia is definitely very helpful, not just, of course, for the healthcare system, but also for the patient. Because they talk, in some countries, there are concerns about, well, it takes a very long time for the patient to get confirmation about are they sick or not. Whereas, in our case, it would happen in the scope of 24 hours. So you would be able to get your test results either from an official or actually by checking them yourself at a national patient portal. So this kind of interoperability has definitely been very useful for us, and we've tried to make it even better during this crisis. So we've tried to make it more real time for data to move faster about hospital capacity and mortality rates and all that kind of thing. So that's been definitely very helpful. But we did roll out a number of services that were not present before. So, for example, one issue was sick leave. At some point, schools were closed, which meant that basically overnight, you had a lot of people that had to stay home with their children to transition to this new period where kids were no longer able to go to school. And what would normally happen is that you would call your general practitioner and say, well, now I need to take care leave because I need to look after my child who is at home. And this would definitely clog up the system because overnight, everything changed. So what we did was we quickly rolled out a service where care leave and sick leave can actually be applied for online. So you don't even need to speak to a doctor for it. You can initiate the process yourself using your patient portal, and then the doctor will get to it when they have the time for it. So that was something that avoided a lot of bottlenecks for us. And something that we've always been kind of flirting with, and what we've been trying to introduce more of, is remote visits. So obviously a lot of normally scheduled planned care had to be canceled because we just couldn't allow people to go into hospitals anymore. And since Estonia is small, we've always been kind of slow to adopt these remote services, but all of a sudden it was absolutely necessary that you have to have a remote connection to your doctor, and not just for a repeat visit, for any visit. So we quickly rolled out a reimbursement scheme for this. I mean, of course, digital tools to do these visits have always existed, but then, they weren't as well regulated before as they were during the crisis. So this was a small policy change. And what you might have heard is that Estonia also had a hackathon. So we try to get different, companies and entities to build solutions which the government might need, or which workers or hospitals might need during the crisis. And so we had this quick hackathon, 48 hours, which actually produced a lot of good results, which we still use today. So for example, the first interactive map, which visualized data about the spread of the coronavirus, actually came from that hackathon. It was a company called Oki which did that, and which we still use, which we've now integrated better with our National Health Board. Another thing that was developed was a chatbot, so that when people had questions about coronavirus testing or anything else, then they no longer needed to call us. They could actually talk to the chatbot, and this was rolled out within that same time frame. And one thing which I was a part of was called coronatest.ee, which was a way to, it's basically a symptom checker. So you would enter your symptoms, answer a few questions, and it would give you back what is your risk of being infected, and then some instructions about, do you need to stay home? Do you need to notify people that you've been in contact with? But it was never always just a symptom checker. It was also a self-reporting tool. So through this, we also got anonymous data about how many people might be at risk for disease, how many people might be coming into the healthcare system in maybe 5 or 10 days' time because they just recently contracted symptoms which are indicative of coronavirus. So this was also a resource planning tool for us, which we still use today. So a lot of these interesting solutions came out during the coronavirus epidemic, and I wouldn't be able to enumerate all of those, but these definitely come to the top of my head. And one thing which we are not actively involved with here at the ministry, but which has been very helpful for healthcare providers, has been a community of volunteers. It used to be called Vanemuine. I think now it's called Bob. So if you have any medical training, then you can register in that community, and then different hospitals can come to you and say, okay, I need your help. I will offer you a volunteer position in my hospital. So this system has been also set up during this hackathon.
So it's a great account of all initiatives, and it sounds like all the best practices we hear from the world are basically coming back and being developed in one place in Estonia. When we talk about and you mentioned that that's the Corona app or web. When we talk about these self-assessment and tracking tools, we saw many of them developed also in Singapore or elsewhere in Israel, etc. How can the contact tracking mobile apps, because we also see a high rise of new apps being added in these times, how can these be helpful, and how do you see their development and implementation in the society going forward?
Yeah, I'll just slightly correct you there. The Corona tracing app is something that we're developing now, whereas the Corona self-symptom checking app is something that we developed almost a month ago. So the contact tracing app is slightly different. It's meant for basically finding out if an infected person had been in contact with another person and notifying them automatically. So normally there's this manual process called contact tracing. And this happens in Estonia, it happens in everywhere else. When we in the morning get data about, so these are the new infected persons, we take the day to call them up. And we will ask them, can you recall, where have you been? Who have you talked to? Can you give us some contact details of the people you talked to? Because those are the close contacts that we want to notify and that we want to remove from actively interacting with other people, because they would otherwise be at risk of transmitting disease to even more people. So this is done manually, and it's still being done manually, but we are developing an app which would help with that process, and many other countries have also done that or are doing that at the moment, which would then work where people download an app to their phone, and this via Bluetooth would exchange anonymous identifiers with other people that they interact with. So if you spend enough time with a person, your phones will exchange anonymous identifiers and store them for a certain amount of time. And if I am found to be infected, then I will upload my anonymous identifiers into a server, and all the other phones can then check from that server, have I been in contact with this identifier? They would never find out who I am or even when they were in contact with me. But they will know that you have been in close contact with a person who has been later diagnosed with coronavirus. And this is something that would help the manual contact tracing process, because infected people via interview are not able to tell you everyone that they interacted with. They might not even know everyone that they interacted with. If they went to the theater last night, they don't know who sat next to them, but the app would then be able to tell that person that actually you have been in contact with this infected person. And then you have a few ways how they might get into contact with the healthcare system. So one option is when they are setting up the app, they tell you that, well, okay, this is my phone number, and if I'm ever discovered to be a close contact, you can have my phone number and call me. Another option, which we're considering, is that we just provide them with a phone number. So you have been detected to be in close contact. Please call this number and we can give you some advice about what needs to be done next. So that would be, the even least invasive method. And of course, there are some problems with these contact tracing tools. I mean, the one that I described is the least intrusive in terms of privacy, where we as a government will not gather any data about interactions. This will only be held on people's phones. So we're not even able to build an anonymous kind of social graph of people, because that might have a slight risk of us identifying them afterwards. Of course, these systems can be built otherwise. Sometimes you can have a centralized system where the calculation about have these two identifiers been in contact gets done in a government backend server. But in this case, the government would be gathering more data. It would increase the risk of identifying the people behind the data, which is why we are not following it. But that's definitely one way that it can be done. And of course, solutions that would never, be considered in Europe, but which have been rolled out elsewhere, is where, where some countries actually look at your bank statement or your GPS location data. So that's something that is out of the question in a European country, but which might be used elsewhere. But here in Europe, of course, we try to take the most privacy-preserving approach that can still be effective in notifying people that they might have the disease and tell them to stay at home and monitor themselves.
Great. So when of course, this also requires that we have a collaboration going on between the public and the authorities and healthcare institutions, just to make sure that we log in and download the app and work with it. When we take it further, maybe in terms of collaboration, we've seen it also elsewhere that the countries are collaborating and trying to develop things jointly, fighting this COVID-19 pandemics. When we look at Estonia, can you tell us more how you cooperate internationally with other public or private organizations or other countries?
Yeah, cooperation is important, especially in a pandemic, because we're all involved and these diseases can move across borders. So when it comes to this same contact tracing, it's actually important that we do align on some things with other countries, because it's unlikely that we're going to have just one app for all of Europe, because we need to still integrate with different country backends. But if there are different apps, if there's an app in Finland and an app in Estonia, it's important that they are still able to change some information, so that if I travel to Finland and am later diagnosed in Estonia, then my information, my anonymous identifiers in this case, would still be accessible to people using the Finnish app. They could still find out that they have been in close contact with a person, and it doesn't really matter if that person is a native Finn or if it's an Estonian who just uses an interoperable app. So we actually have had a lot of meetings within the European Union about this topic of contact tracing, and they're still ongoing. So you might have seen that the EU even had published recommendations for contact tracing applications and a toolbox, which would help us align more on the process. But of course, it's difficult, particularly if you have centralized systems and decentralized systems. They're built up in such a way that it's very hard to make them interoperable, but it's a challenge that we're trying to tackle. But even if we don't tackle that, we can still agree on some of the principles. You know, we can agree that this needs to be privacy preserving. We can agree on what constitutes a close contact, for example, because this also varies. In some countries, a close contact might be 30 minutes. In every country, it might be 15 minutes. So having this understanding is important. And which is why we continue to speak to each other, not just, of course, within the EU, but also bilaterally. So with these contact tracing apps, it's been very important to me to also speak to our neighbors, you know, Latvia, Lithuania, Finland, to find out more about what they are doing and how we might make our solutions work with each other. And some collaborations, of course, started a long time ago. So you might have heard that Estonia and Finland can exchange cross-border e-prescriptions, because there's a lot of transit between our two countries. People who live in Finland might work in Estonia and vice versa. And at some point, borders closed. So people couldn't even maybe go back for a while, but they might need a prescription. So if you have this cross-border prescription, then it doesn't really matter. You know, you can still get your Estonian GP to write the prescription, but you can buy it in Finland. So these kinds of systems, which of course are applicable outside of a pandemic, will also help within a pandemic.
Great. Thank you very much appreciated. Thanks a lot for your insights, and looking forward to seeing you in the future of health in the future.
Thanks a lot. See you there.
Okay, so we've heard the presentations from interviews from our speakers, and I'm glad to welcome Ali, Ciger from Pfizer, Priit, Tohver from Estonia, Shafique from Ur-Rehman in Pakistan, and I believe we also have Beny, Rubinstein on the phone from Israel. So thank you all, gentlemen, for joining the live Q&A session today. So we have not seen any questions flowing from our chat as of now, but while we are doing so, maybe while we're waiting for them, maybe the first question. Actually, we have one already coming here. So it's a question from Manisha Sundar to all panelists here. So how can we collaborate pharmacovigilance reports with digitalization, and will artificial intelligence increase job scale in PV and clinical pharmacovigilance in clinical trials. So that's maybe a question which may go into our another stream, perhaps, that will be on the clinical trials and pharmacovigilance here. So I would maybe pick one, and that basically is about the healthcare models that may arrive after the COVID-19 in retrospective of the how developing we are now seeing in development in terms of digital healthcare. And that's the question of, and anyone who wants to pick it up, will we see more efficient use of healthcare by patients with the aspects of digital healthcare being potentially used more after the COVID-19? So we have seen a lot of unnecessary use of healthcare being consumed by patients and maybe also by being prescribed. So will we see any efficiency gain from this also in terms of the pressure on the healthcare systems overall? Anybody wants to pick it up?
So in terms of efficiency, I guess there's a number of ways that we might approach this, but I think one thing that is definitely here to stay, and what the coronavirus crisis has proven that we need, is more remote care, more telemonitoring, telemedicine. And as far as we've done studies in the European Union about the cost effectiveness of these kinds of solutions, overwhelmingly see gains when you implement them, even if it's not from the perspective of the medical system, it's from the perspective of the general economy in terms of times of hours of work missed, hours having to spend commuting. So I think in that sense, there's definitely a scope for efficiency post-COVID as we become more comfortable with this remote visit structure, because it's always been a good idea, I believe, but there's always been a bit of resistance. Can I really do a visit over some kind of remote? But this crisis has given a lot of doctors the first-hand experience of what it's like to do these visits, as well as patients, and the feedback has been positive.
Great to hear that. So we may, of course, see more consultations on telehealth and more televisits. We also saw I think it was one of the American hospitals, 100% increase. Shafique, would you like to add?
Yeah, I think I shared Priit's views. Definitely, we will see an efficiency gain overall in the system. Even on the provider side, I might like to add that increasingly you'll find they'll find themselves in a very challenging situation whereby the only way of moving forward and survival is to improve efficiency. There has been a lot of inefficiency in the system for a very long time. The opportunity to optimize things through digitization and otherwise have existed for a very long time, but the urge to do so and to adopt those honestly did not exist. And what the current situation provides us is an opportunity to do that on a fast-track basis, both on patients where with increasing technology access, where they have options available, they have to make a decision whether they really want to go into a hospital for a service or a pre-consultation service that they could avail remotely. So we will definitely see greater optimal utilization and efficiency gain for the system as a whole.
Ladislav, if you allow me just to add a few points to that, I fully agree with the points raised here. I think there is a lot of evidence, telehealth is not something new. Worked with the NHS and the Ministry of Health in Canada 10 years ago, and as part of Microsoft research, and he was still kind of. I would say that the three ways that we're seeing that change today, as we build what we're calling, for the lack of a better name, the new normal in healthcare, is, as we know, the ecosystem has many angles. I think from the patient's side, we already see kind of we're crossing this psychological hurdle. I mean, people are less concerned about the discomfort of not being physically next to a doctor. There's an increase in awareness of kind of remote solutions. I see a lot of the companies here in Israel, for example, they're not necessarily brand new companies. They've been in business for several years, but they had a huge spike now, of course, and I think that will persist. By the way, there's another point that I think it's interesting to see and to learn from other countries. China, the lockdown has been removed. Some portions of China has shown already an increase in the evidence of remote care extensive use. So I think on the patient side, it's clear. I think that, again, on the healthcare system side, we've been trying for years to prove the ROI for telemedicine. I think now more than ever, as you say, adversity is your best friend. There is an incredible on the financials. So there's a clear ROI. There is also obviously an issue of capacity. As we all know, most healthcare systems are getting a sort of capacity and professionals working 24/7, and there's no equipment or rooms. So I think all of that would also be another catalyst for this whole digital transformation that we've been trying to drive for years. And now I think COVID-19, in a very odd way, kind of helped accelerate. And finally, just to complement, I think there is another area, which is the payers and regulators. I think we are seeing already the FDA being somehow forced to facilitate the use of remote managed clinical trials. There are new regulations coming on patient health data, which has been a topic of discussion for a long time. And there's just a much wider coverage of remote care, across different states in the US, for example. So as we all say, necessity is the mother of invention. And then I think out of these tragic times, we're going to see a lot of improvements.
Yeah.
Thank you.
Maybe to conclude, I can only echo what has been said and maybe build further on what Beny has introduced the idea. I don't think, again, efficiency is not an option anymore. Like it's the way to go. It's quite clear that like the pandemic is like the massive earthquake. There would be two tsunamis to follow on the healthcare system. Probably the first would be kind of the bounce back. Resource restriction on urgent non-COVID issues. Then there would be the impact of the interrupted care for other chronic conditions. And then, of course, there would be the increasing mental health burden. So, like, even if the COVID ends, like, just like that, it won't be over. Like, the burden won't be over for the healthcare systems. So efficiency is not an option. We just have to embrace this fact, I think.
Great, thank you. We have questions while we're talking come in here, and we won't be able to answer all of them. So we probably would ask you to take them offline, and because there are some of them addressed to particular speakers. But perhaps the final one, if you can tell of any sort of failures in virtual health that you're aware of, even despite all the success we have seen here, would you know of any? Is anybody aware of anything that we should, maybe there's a finger on some caveats that we should probably take?
Well, speaking from a research perspective, there was recently a PricewaterhouseCoopers study about the cost effectiveness of these telemedicine solutions. And whilst 75% of them were found to be cost effective and would add to quality adjusted life years, 25% of them are failures. So we have to be realistic that just doing something remotely is not gonna guarantee success. You're always gonna have to consider which this can go downhill, thinking about also what is the digital skill level of the people that you want to apply these solutions to. So we can't really expect people who are not as self-sufficient to use complicated machinery to communicate with their doctor. In those cases, you need very simple tools. You need to think about how you engage the carers, how you use the doctors as coaches for these kinds of remote services. If you don't take this into consideration, you are setting yourself up for failure. But fortunately, in most cases, people are using these solutions wisely.
Gentlemen, we're at the bottom of the hour and just about to start the next stream. So anyway, thanks a lot for your answers and for your time being spent with us here. And definitely we'll be sending over some most interesting questions that may also be then posted on our Y Summit webinar webpage after the event. So thanks a lot for your time again, and hope to see you in the future. It was great working with you and talking to you.
Thank you all.
Thank you.
Thank you very much.